Alright guys, I'm Dr. Christine Nwoha. I'm an internal medicine doctor that believes in reversing disease, okay? Reversing all kinds of diseases like high blood pressure, diabetes, weight gain, okay? All of these things can be managed naturally through lifestyle. And I think everyone is catching on. But most importantly, I have 3 books, one of which is Reverse High Blood Pressure Naturally. It is available on Amazon, but I'm doing a read through here chapter by chapter so that those who cannot get the book can still benefit. And if you want to get the book and read ahead, follow along, you can do that. This is going to be a loose grasp of the book. I'm going to be looking down, reading the book, explaining some concepts in depth, really breaking it down if I can. We're going to laugh here. We laugh here. Okay, we laugh here. We have fun here. We're not picky about things because we're all here to learn, including me. Because I'm definitely learning how to manage this camera and how to speak to you guys and break things down in a way that you understand. So bear with me. So we are going to be getting into chapter 6. The last video we covered chapter 5. Okay, and I broke down how this book works, part 1 and part 2, and part 2 is more of the educational concepts, and that's what we're going over now. So we are at chapter 6, and it's going to be what causes hypertension. Now, I think this chapter is very important because you got to know what caused it for you, okay? If you're going to reverse anything, you need to know what the cause is so you can get to the root of it. What causes high blood pressure for certain people is different. Okay, so if you're looking into what caused high blood pressure for me, trying to solve it for yourself, then you may not be successful. So we're going to get into the causes. Now, hypertension, as I broke down in this book, is broken down into primary and secondary hypertension, okay? So we can categorize high blood pressure into 2 types, primary, which is essential, and secondary hypertension. Secondary hypertension basically means there is a health condition that is causing the hypertension. I want you to know that it's not too common. Most of the blood pressure that we deal with is primary, but if it is secondary, that means another condition is causing your high blood pressure. You need to look into that. Now, first let's start with the primary hypertension. So primary hypertension develops gradually over many years, and the causes are not very clear. Okay, so it may not be clear cut, but this is one of many. 1, genetics and family history. Okay, if high blood pressure runs in your family, then you are more likely to develop it. Okay, that would be a great sign to monitor your lifestyle and make changes accordingly. Now, the reason I put those spirit wavy fingers up is because high blood pressure runs in my family is not a reason to accept it. High blood pressure runs in my family is not a reason to, woe is me. This is where I'm at. I'm not coming back from it. High blood pressure, this is how you remain active and vigilant. High blood pressure runs in my family, therefore I'm going to always check it once in a while. I'm going to keep a close eye on my lifestyle, what I eat, what I do, how I live to prevent it. I'm going to be vigilant about it. My mother always says, to be forewarned is to be forearmed. That is how you use genetic and lifestyle to your advantage. That is how you use genetics and family history to your advantage. You know what to prepare for, not you know what to sit back for. There's a difference. Okay, now, age. The risk of high blood pressure increases as you age. Okay, so you may have struggled with it. You may not have struggled with it in your teens. But you notice as you start to get older, and I have clients that tell me that I was eating this way and I was fine. I never had high blood pressure then, but now it is becoming a problem. Men are more likely to develop high blood pressure before the age of 55, while the likelihood increases for women after menopause. A lot of women going through menopausal changes are now coming down with these conditions. And they're like, whoa, this is a lot to keep up with. I understand. Race, number 3. People of African heritage or the Black race are believed to be more commonly affected by high blood pressure. It may be severe and appear at a younger age than in Caucasians. And that's something, again, that you have to be mindful of, that you cannot ignore. Okay, so you may be dealing with a little bit more a little earlier. I'll talk about this more in the later chapters, okay? Diet. It is no mistake that a high salt, high fat, low potassium diet can lead to elevated blood pressures. Okay? I'm not saying that salt is the cause. Don't come for me with that. Don't say I said it. But I'm saying that a high salt, high fat, low potassium diet is usually the case with processed foods and thus elevated blood pressures. This is why individuals who consume processed foods are more likely to develop hypertension. Number 5, physical activity or physical inactivity. Lack of exercise increases the risk of hypertension. It does. Don't fight me on that. It does. Okay. Number 6, obesity. When there is more body mass, the body needs to supply more oxygen and nutrients. This can lead to added pressure on your artery walls and elevated blood pressure. It's also important to remember that obesity itself is an inflammatory condition. So we're not only just talking about the body mass, we're talking about what goes on in the body with obesity and the inflammation going on, the inflammation in your vessels, the inflammatory cascade that is constantly going on in the setting of obesity. Alcohol and tobacco. Regular heavy alcohol consumption and smoking tobacco I say can, but I believe it will. I've seen cases when it doesn't, but more than likely can increase your blood pressure. Cut it out. Cut it out. Stress. High levels of stress can lead to temporary increases in blood pressure, but over time it can be irreversible. But when I say irreversible, I mean when you're not trying, because we're trying to reverse it. And I'm just letting you know the stress. And I have plenty of clients with high stress lifestyles. They've developed high blood pressure and we reverse. And we reverse, okay? Now, next we talk about the secondary hypertension. Secondary hypertension is caused by another condition. Like I said, it appears suddenly. That's the thing I need you to understand. Boom, all of a sudden you got hypertension overnight, and that should be a clue to go into your doctor. Sometimes you might have to push for this. Sometimes you might have to give them a little more insight. This is where education really matters, because you tell your doctor that, hey, this is not normal for me. I don't care what you're saying, and I need this investigated. And you got to advocate for yourself, okay? Now, another thing that you need to remember about secondary hypertension that I say here is that a lot of times with secondary hypertension, your blood pressure ends up a lot higher than primary hypertension. With primary hypertension, blood pressure is slowly going up over time, 130s, 140s, 150s, 160s. Secondary hypertension, boom, you in the 180s, it just came out of nowhere. That's how it's going to feel. So while primary hypertension may present like that because maybe you didn't check it, secondary hypertension has more likelihood of doing this, and it's more severe. Now, here are some causes. Kidney disease. You need to understand that kidneys play a role in maintaining the blood pressure. In any condition that affects the kidneys, chronic kidney disease, kidney infections can raise the blood pressure. If you have acute kidney disease, glomerulonephritis, some kind of autoimmune kidney disease that happens out of the blue, blood pressures will be severely elevated, and that could be a sign. Okay, so you got to treat that. This isn't time to focus on the blood pressure reverse. No, you need to treat that. Okay, and this is why it's important to figure out when secondary hypertension is at the bottom of it. Okay, adrenal gland disorders. Conditions affecting the adrenal glands like Cushing's syndrome, pheochromocytoma can lead to high blood pressure. You need to know that. Thyroid problems. Thyroid problems, both hypo and hyperthyroidism, can cause high blood pressure. You need to know this. A lot of times people associate hypothyroidism with low blood pressure, fatigue, dryness, constipation, dry skin. But it can also cause high blood pressure. Hyperthyroidism, you're going to be on edge, your eyes, you're going to have some exophthalmos, all of that, heart's racing, and you're going to have high blood pressure. Again, if you have no symptoms, it is not time to, I'm going to change my diet, seeing if I can lower my blood pressure. No, you need to, don't pass go, don't collect $200. I need you to go to your PCP, go to your provider, healthcare provider, and find out what is causing this so you can turn that around and your blood pressures can be improved. Sleep apnea. Okay, this is one thing that I always screen for with my patients that have high blood pressure. Are other people complaining? You may not know that you have sleep apnea. I mean, you may have some signs. Maybe you are not sleeping very good. You wake up, you sleepy. You go to the car dealership to go have your car worked on and you sleeping. You've been there napping. Every chance you get, you're snoring. That was a sign with my daddy. We went to the dentist and he was in there snoring. And I'm like, Daddy, I mean, did you sleep last night? That should have been a clue. Are people complaining? They don't want to share a room with you. They don't want to go on vacation with you. You waking the whole house up at night. You may have sleep apnea, and that can cause high blood pressure. Certain medications. Now, I say this a lot. If you go at my page, if you go on my social media, I'm talking about medications that are causing high blood pressure. Stop it, okay? And some of them you can't stop, but you need to be aware of what they are. Certain drugs such as birth control pills, decongestants, you got a cold, you got a sinusitis, you're squirting things up your nose, you know, they are raising your blood pressure. Over-the-counter pain relievers, people don't think about that. Some NSAIDs can raise your blood pressures if taken chronically. Certain prescription drugs can cause secondary hypertension. So just be aware. Congenital blood vessel defects. If you have this, more than likely, you know, you were born with this. Somebody called it as congenital, but just know that this can be a cause. So you may want to work with your heart doctor, your cardiologist, to get to the bottom of your blood pressures. And then illegal drugs. Illegal drugs, baby. There are a lot of illegal drugs, cocaine, amphetamines that can significantly raise your blood pressure. And while we'll get into this in the coming chapters, but just know that these acute raises in your blood pressure can affect you over time. It's not something to ignore. It's not something that, okay, it's just while I do the drugs and my blood pressure is elevated, because real damage is being done. So then we end off the chapter saying identifying the cause of high blood pressure will be important for treatment. For primary hypertension, lifestyle changes like exercising, reducing salt in the diet, and managing stress can be very effective. Can be very effective. Treating the underlying condition, if treatable, can often improve secondary hypertension. So again, don't pass go. Don't collect $200. If you got secondary hypertension, primarily work with your primary care doctor. Figure it out with your nephrologist, your kidney doctor, your cardiologist. Get to the bottom of it. If you have sleep apnea, get a CPAP, get a sleep study. Take care of that. Lose weight. And that's going to make treating the hypertension a lot easier. We're done with chapter 6. Next, we're going to be moving on to chapter 7, where I'm going to answer a deep question. Stay tuned. And if you can't stay tuned, get the book, read ahead. Like, share, subscribe, share this with people. Y'all, hey, come on. We've been in a community here. We are reversing high blood pressure here. We are happy here. We are laughing here. I wish you the best, and I'll see you later.